Cirrhosis of the liver is a chronic liver disease that causes scarring and damage to the liver tissue. The liver is a vital organ that performs many important functions in the body, such as filtering toxins from the blood, producing bile to aid in digestion, and storing nutrients. Cirrhosis occurs when healthy liver tissue is replaced by scar tissue, which can lead to a variety of complications such as liver failure, liver cancer, and portal hypertension. The most common causes of cirrhosis are long-term alcohol abuse and chronic viral hepatitis, although there are other less common causes such as autoimmune diseases and genetic disorders. Symptoms of cirrhosis may not appear until the disease is advanced, and can include fatigue, weakness, jaundice, abdominal pain, and swelling in the legs and abdomen. Diagnosis of cirrhosis typically involves blood tests, imaging studies such as ultrasound or CT scans, and a liver biopsy. Treatment for cirrhosis depends on the underlying cause and the severity of the disease. For alcohol-related cirrhosis, the most effective treatment is to stop drinking alcohol. Medications may be prescribed to manage symptoms and complications, and in some cases, a liver transplant may be necessary. Prevention of cirrhosis involves avoiding or limiting alcohol consumption, practicing safe sex to prevent viral hepatitis, and getting vaccinated for hepatitis A and B. It is also important to maintain a healthy diet and exercise regularly to keep the liver healthy. In conclusion, cirrhosis of the liver is a serious and potentially life-threatening disease that can have a significant impact on a person's health and quality of life. Early diagnosis and treatment are important in managing the disease and preventing complications. Cirrhosis of the liver is a chronic and progressive disease that is caused by various factors. The liver is responsible for filtering toxins and waste products from the body, producing bile to aid in digestion, and storing nutrients. When the liver is damaged, it can lead to cirrhosis, which is characterized by the scarring of liver tissue. One of the most common causes of cirrhosis is excessive alcohol consumption. When alcohol is consumed, it is processed by the liver, and over time, excessive alcohol consumption can lead to liver damage and cirrhosis. This is because alcohol causes inflammation and oxidative stress in the liver, which can lead to the formation of scar tissue. Another common cause of cirrhosis is viral hepatitis, which is a viral infection that affects the liver. Hepatitis B and C are the most common types of viral hepatitis, and they can lead to liver damage and cirrhosis over time. Hepatitis B and C are transmitted through blood and bodily fluids, and can be prevented through vaccination and safe sex practices. Non-alcoholic fatty liver disease, NAFLD, is another cause of cirrhosis. NAFLD is a condition in which fat accumulates in the liver, and it can lead to inflammation and scarring over time. NAFLD is often associated with obesity, diabetes, and high cholesterol, and can be prevented through lifestyle changes such as diet and exercise. Other less common causes of cirrhosis include autoimmune diseases, genetic disorders, and exposure to toxins such as chemicals and drugs. Autoimmune diseases such as autoimmune hepatitis can cause the immune system to attack the liver, leading to inflammation and scarring. Genetic disorders such as hemochromatosis and Wilson's disease can also lead to cirrhosis, as they affect the liver's ability to process certain substances. Exposure to toxins such as chemicals and drugs can also damage the liver and lead to cirrhosis over time. In conclusion, cirrhosis of the liver is a chronic and progressive disease that is caused by various factors. Excessive alcohol consumption, viral hepatitis, non-alcoholic fatty liver disease, autoimmune diseases, genetic disorders, and exposure to toxins can all lead to liver damage and cirrhosis over time. Preventative measures such as vaccination, safe sex practices, lifestyle changes, and avoiding exposure to toxins can help reduce the risk of developing cirrhosis. 1. Leafy greens. Leafy greens such as spinach, kale, and collard greens are high in antioxidants and fiber, which can help reduce inflammation and improve liver function. 2. Oily fish. Oily fish such as salmon, tuna, and sardines are high in omega-3 fatty acids, which can help reduce inflammation and improve liver function. 3. Garlic. Garlic contains a compound called allicin, which has been shown to have anti-inflammatory and antioxidant properties that can help improve liver function. 4. Berries. Berries such as blueberries, raspberries, and strawberries are high in antioxidants, which can help reduce inflammation and improve liver function. 5. Walnuts. Walnuts are high in omega-3 fatty acids and antioxidants, which can help reduce inflammation and improve liver function. 1. Alcohol. Alcohol is a major contributor to the development of cirrhosis of the liver. It damages liver cells and causes inflammation, leading to scarring and ultimately cirrhosis. Avoiding alcohol is crucial for preventing and managing cirrhosis. 2. Fried foods. Fried foods are high in unhealthy fats and calories, which can lead to obesity and fatty liver disease. Fatty liver disease can progress to cirrhosis if left untreated. Choosing grilled, baked, or broiled foods instead of fried foods can help reduce the risk of cirrhosis. 3. Processed meats. Processed meats such as bacon, sausage, and deli meats are high in sodium and nitrates, which can increase the risk of liver damage and cirrhosis. Choosing lean cuts of meat and fresh, whole foods instead of processed meats can help protect the liver. 4. Sugary drinks. Sugary drinks such as soda and fruit juice are high in sugar and calories, which can lead to obesity and fatty liver disease. Fatty liver disease can progress to cirrhosis if left untreated. Choosing water, unsweetened tea, or low-sugar drinks can help reduce the risk of cirrhosis. 5. Salt. Consuming too much salt can lead to fluid retention and high blood pressure, which can increase the risk of liver damage and cirrhosis. Limiting salt intake to less than 2,300 mg per day can help protect the liver. Cirrhosis of the liver is a serious condition that can lead to liver failure and other complications. However, there are steps that you can take to prevent cirrhosis and protect your liver health. First and foremost, it is important to limit your alcohol intake. Excessive alcohol consumption is a leading cause of cirrhosis, as it can damage liver cells and cause inflammation. If you do drink alcohol, it is recommended that you do so in moderation. This means no more than 1 drink per day for women and no more than 2 drinks per day for men. Another important step in preventing cirrhosis is maintaining a healthy weight. Obesity and being overweight can increase your risk of developing fatty liver disease, which can lead to cirrhosis over time. Eating a healthy diet and getting regular exercise can help you maintain a healthy weight and reduce your risk of liver damage. It is also important to avoid exposure to hepatitis viruses. Hepatitis B and C are both viral infections that can cause liver damage and lead to cirrhosis. You can reduce your risk of contracting these viruses by practicing safe sex, avoiding sharing needles or other drug paraphernalia, and getting vaccinated against hepatitis B. Finally, it is important to manage any underlying health conditions that can increase your risk of cirrhosis. These may include diabetes, high blood pressure, and high cholesterol. By working with your healthcare provider to manage these conditions, you can reduce your risk of liver damage and protect your overall health. In summary, preventing cirrhosis of the liver involves limiting alcohol intake, maintaining a healthy weight, avoiding exposure to hepatitis viruses, and managing underlying health conditions. By taking these steps, you can protect your liver health and reduce your risk of developing this serious condition. Cirrhosis of the liver is a serious condition that occurs when the liver becomes damaged and scarred over time. This can lead to a variety of health problems, including liver failure and even death. While there is no cure for cirrhosis, there are several ways to manage the condition and slow its progression. One of the most important steps in treating cirrhosis is to identify and address the underlying cause of the condition. This may involve treating viral hepatitis, managing alcohol use, or addressing other underlying health conditions that may be contributing to liver damage. In addition to addressing the underlying cause of cirrhosis, there are several other treatment options that may be helpful. These include 1. Medications. Certain medications may be prescribed to help manage the symptoms of cirrhosis and slow its progression. These may include diuretics to reduce fluid buildup, beta blockers to reduce the risk of bleeding, and antibiotics to prevent infections. 2. Dietary changes. Eating a healthy diet is important for managing cirrhosis. This may involve reducing salt intake to help manage fluid buildup, increasing protein intake to support liver function, and avoiding alcohol and other substances that can further damage the liver. 3. Liver transplant. In severe cases of cirrhosis, a liver transplant may be necessary. This involves replacing the damaged liver with a healthy liver from a donor. 4. Lifestyle changes. Making lifestyle changes such as quitting smoking, reducing alcohol intake, and getting regular exercise can also be helpful in managing cirrhosis. Overall, while there is no cure for cirrhosis, there are several ways to manage the condition and slow its progression. By addressing the underlying cause of the condition, taking medications as prescribed, making dietary and lifestyle changes, and in some cases, undergoing a liver transplant, individuals with cirrhosis can improve their quality of life and reduce their risk of complications. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.